Better health now. The opioid crisis plagues all parts of the country, including many here in Western Mass. A forum tomorrow at UMass is set to address some of those issues.
Yeah, it's a wide-ranging problem here. And joining us now, Dr. Peter Friedmann from Baystate Health. You're going to be a part of this forum here, Doctor. What are you expecting? First of all, is it going to be, I'm guessing, passionate? You're going to get some personal stories as well from something like this to really show the impact of the crisis?
Yes, so it starts tomorrow at 8, goes till around 12:15, and you'll hear the range of data from researchers like myself. There will be people affected by the opioid crisis speaking as well, advocates, members of community coalitions, others involved. So there really will be a well-rounded view of what's going on in our region, both in terms of the challenges we face and the progress and solutions that we are working towards.
And what is your overall goal and hope for this event?
Well, the goal for events like this usually is to raise awareness, to inform the public about what when I say we, folks in the public sphere, both institutions like UMass and Baystate, where I work, are doing to try to improve the problem. Also, what's happening in our counties, county governments, and in the state writ large, in terms of trying to come up with solutions. So to let people know what's being worked on, the progress that's been made, and hopefully to try to motivate some people to get involved with helping improve the problem.
Are there any misconceptions when it comes to the opioid crisis or mischaracterized parts of this that maybe are being overlooked even as well?
Yeah, there are a lot of aspects. I mean, that's part of what makes it so challenging to deal with, because there's a lot of myth about the disease, and I do view it as a disease. I think there's still a lot of people who view it as a social issue or as a character flaw.
Yeah, personal choice, and then you're doing it to yourself,
right.
sort of deal.
So there's a lot of that. There's also a lot of stigmatization of some of the most effective treatments we have. So many of the most effective treatments we have involve the use of medication, and there's still a lot of misconceptions about things like methadone and buprenorphine that people say they're substituting one addiction for another, which is not true if you really understand the nature of the disease. Hopefully we'll have a chance tomorrow to talk more about that and try to get rid of some of those myths in the public.
Absolutely.
Yeah.
And there, right there on your screen right now, is that information. Can anybody come to this?
Yes, it is open to the public.
All
yes.
right, cool. And
Thank
it's up
you
at
so
UMass.
much
Thank
today
you.
for bringing awareness to an important issue.
Thank you for having me.
Thank you again, Doctor.